You should not come to the doctor when you're having pain in the ulcer. They will say give sunlight, somebody will say air to make it dry. No, that is not correct. I always say foot and footwear. These are very important. Your foot is also important and what you wear is also important. If you wear a tight shoes, that means you are cramping the whole tissue in one particular shoe.
What is the role of antibiotics in treating diabetic ulcers?
Antibiotic usage is so high.
Could you put some light on laser treatment?
For everywhere we are seeing laser. And as technology is becoming more and more, so they have also found that the laser in the diabetic ulcer helps in the
So nowadays our science has improved a lot. So new technology, new trends of surgical technology has come up. So right now, what are the technologies or surgical technologies you are using right now?
Yes, see, the main thing is that we have to heal the wound. That ulcer
That's
has to
our
be
main
healed. So that is our main aim. How we do it, that is the thing. Yes, so we have got some new technology that has come. Beside dressings, beside other measures.
Yes.
Now, the one of the measures that people, many doctors are doing is the laser therapy.
Laser therapy.
Laser therapy. They have a very low laser therapy over the wound, and that helps in the healing of the wound faster.
Okay.
Then there are other things, electrical stimulations, short wave lithotripsy is there, but these are very costly and cumbersome. Laser therapy is one which can be done in the OPD basis, and it is helpful. It is not very costly also. Now in other
And healing is
very fast. And in other countries we have got like 3D printing materials can be put over the wound area, which again lead to early healing, but it is costly. It has not yet come very vogue in our country, and so these are the latest technologies that are coming into picture, and let us see how much it improves.
Sir, what are the common myths and misconceptions about diabetic ulcer?
Yes, there are many myths going on in the public mind. First of all, they don't come to the hospital because they think that this is painless thing. It is not going to cause problem.
Yes.
So pain, they will come only when you start having pain. So that is not correct. Usually the symptom starts with like tingling sensation or numbness. That means there is no pain because the sensory neuropathy takes place. So if you have them, you come to the doctor. Doctor will tell you when next to come. He may do some test and say we can send them to straightway to orthotist at that time also, because
save the limb.
Yeah, to save the limb, because now he should be able to give a good footwear where it can be redistributed. So that is the thing. So that is one myth. You should not come to the doctor when you are having pain in the ulcer. First of all, you come before you are having ulcer, when you are having no pain. That is the time to come. The other myth is that they try to keep, I have seen many patients diabetic try to keep the wound open.
Wound open.
Yes, they will say give sunlight, somebody will say give air to make it dry. No, that is not correct. We have to keep the wound clean. We should not, external dirt should not get into the wound, and wound should be moist, and it should not be infected. That is the whole idea. Slowly it will heal. It will take some time. The other thing that the myth is there, that the doctors usually don't doctors, the patient don't take care much of their sugar control. Now if you maybe a good doctor, do whatever, but if your sugar is not controlled, then there is a whole point is that it is not going to help. Now certain initially we used to have certain amount of like debriding agent like hydrogen peroxide, that we have stopped doing it because it does not help. But many villages and all that also still they are doing it because they it is a little bit of, not only it destroys the unhealthy tissue, but it also destroys the healthy tissues. So now you have to be very careful in what solution you are using, what dressings you are using, what material you are using to treat your diabetic foot ulcer.
I want to add one thing. I think nowadays people in India, people will listen to the neighborhood or the person who is next to them.
Yes.
Might be they don't have knowledge about all these things, but they'll ask and they'll go to some doctors. Those who don't who are not properly have knowledge on these particular things.
Yes.
And after going there, after getting treatment for a long time, also they end up with foot ulcer, and they'll come to you with a different possibilities. So you should take proper advice with proper persons. I feel
Yes,
that
yes.
is very important. No one, and like you cannot ask everyone that I'm suffering with this one. Tell me something. I'll go where I have to go. So finding good doctor and those who can give you proper solution, that is also very important.
Yes, you are very right. And one more important thing is that I have seen is that, see, a lot of people say you should walk barefoot. If you're a normal person and you don't have, you're not a diabetes and you're not having any painless thing, then you can walk barefoot, no problem. But if you're a diabetic and you have started having these symptoms of tingling sensation, numbness in your foot, then walking barefoot is not advisable.
Yes.
You must have a footwear to walk. Barefoot walking leads to small trauma and is one of the reasons for an ulcer to form.
I've listened this one also. Sir, when a patient comes to you, there may be chance of wound on the forefoot area, plantar surface
Yes.
of the foot. How do you differentiate this is the diabetic foot ulcer or it's a normal wound?
Okay. So diabetic foot ulcers, patient usually will give a history of diabetes they have, or we can get their sugar test and we'll come to know that they are diabetic foot ulcer. Seeing the characteristic of the wound, they're usually at the pressure points on the foot that I have told you that these are the places where they can occur, and they will be having a characteristics, like I told you, callosity.
Yes.
Around, and in the middle of the carotid the rounded punch out margin. So these we can think these probably are, and diabetes they probably can occur because of diabetic neuropathy.
Okay.
So these are the things, and usually other wounds patient will come and tell you that I got a cyst trauma. I met with a small accident and this happened. So you can know this is a traumatic wound and not a diabetic wound. Then the history, the patient will say, I am having this for a long time. 2 months, 3 months I am having. Where the other side, the wound patient will say, I just had for 3 days, 4 days, I fell down. I had a small trauma and I had this wound. So there are ways to differentiate between the diabetic foot and the normal foot. Now, sometimes patient will themselves tell that this small traumatic wound will heal within 7 days or 10 days. They will do their own treatment, but this is the wound that is not healing. They will come and tell. Or it is happening that is healing little bit and again becoming healing, again becoming. So they are also in a doubt why this is taking so much long time. Sometimes patient will come and give a history that not on the foot, but I have a ulcer, I have a cut in the hand, or I have a cut somewhere else in the body, and that when I was young used to take very short period to heal. Yes. But now it is taking 15 days, 20 days, it's not healing, it is healing with a very bad scar. So there we can suspect probably patient is having diabetes, and this is because of the diabetic, the ulcer has developed.
Sir, many people come to you regarding the diabetic foot ulcer. Do you think, or what is your suggestions about the tight footwear? If the footwear is little narrow, is there a chance patient can develop any kind of ulcer?
Yeah, I always say foot and footwear. These are very important. Your foot is also important, and what you wear is also important. If you wear a tight shoes, that means you are cramping the whole tissue in one particular shoe. So mostly nowadays men's are also wearing it, and fashion is there. Women's are also wearing. So this causes more trauma.
Yes.
So it should not be at all tight fitting. Tight fitting in diabetes should be contraindicated. I mean, they should be told, please don't wear. We tell all our patients, don't wear it in tight fitting. And then we tell them to wear from a good quality company also. Because any, in the foot, any manufacturing small things pointing out, that will keep your trauma to a particular point, and that can lead to ulcers. There should be some gap between your toes and the end of the shoes, and it should be loose fitting. That is the whole idea.
Yes.
And if they're having some callosity or the off, better to refer to orthotists. They can advise them what to do, what not to do.
Sir, how does high blood sugar affects foot health?
Yeah. See, what happens is when this high blood sugar is there, so the sugar levels in the blood itself will lead to a decreased amount of nutrients to that area.
Okay.
It has been found that it happens like that. Plus, suppose there is a area where the sugars are very high, so it forms infection nidus. Means the bacteria can grow there much faster and much rapidly in an atmosphere where the sugar in the tissue is very high.
Okay.
So we have to have a like control of the glucose in well within the range. So sometimes when we admit our patient in the hospital for some surgical procedure, we have to shift them from the oral tablet to insulin.
Okay.
Otherwise, things are not getting controlled. And this is a vicious cycle. And if you have an infection, then the sugar goes up.
Okay.
If the sugar goes up, then the wound won't heal. So we have to bring the sugar down. For that, we have to put them on insulin. So when they are in the hospital, maybe after the hospital also, maybe for few days till this wound is healing, they have to be on insulin therapy.
Okay.
And that is the thing. And once the wound heals, then they can switch over to oral hypoglycemic agent.
Yes. Yes.
Or sometimes they might have to continue with the insulin therapy.
Sir, when the patient comes to you and he's suffering with foot ulcer, how do you think that whether the patient is infected, wound is infected or not?
Yes, the patient will give a history that this is there for a long time, and maybe for the recent few days it has started giving him trouble. That is the time when he comes to us.
Mm-hmm.
His wound is there. He is not taking care. He is doing some treatment on his own. Now suddenly, for the few days, it has become a problematic for him. So what is the problem? It can become more red. The redness can spread. It can become a little bluish. It can start giving foul smelling discharge.
Okay.
Frank pus can come, and he may start having fever. And because of fever, other things may start developing. So he is now in a condition where his body immune system is getting affected. It is not localized to that particular foot. It is getting into the systemic circulation. The infection is getting, the bacteria is spreading, and that's why he will come to us.
Okay.
But this is a very grim situation. To come with all these signs, and these are the bad signs.
Mm-hmm.
They should come early.
Yes.
Early you come to the hospital for any reason, then the treatment is less, the mortality is less, morbidity is less, you go home early. Late you come, more you stay, more you get yourself unnecessary into financial, everything will be risky. So hence come early. It is not only diabetic foot ulcer, any ulcer in anywhere in the body, come and show before it gets out of control.
Yes. Sir, when the patient comes to you and he's with the neuropathy condition, neuropathy foot, can diabetic foot neuropathy nerve condition or damage can be reversed?
No, that is the sad part of it.
Okay.
That once neuropathy is developed, it cannot be reversed. We don't have any medication. It cannot be reversed. Now, what we have is that we can prevent the further progression of neuropathy.
Okay.
For that, we have certain medications, certain glycemic control. If a patient keeps glycemic control good, then his neuropathy may not progress.
Okay.
So that is what damage has occurred. We cannot reverse them.
Okay.
But prevention of further damage is possible.
Sir, what is the role of antibiotics in treating diabetic foot ulcer?
Yes, when there is a very small ulcer and there is no discharge, there is no redness around it, then there is no role of antibiotics. But antibiotic usage is so high that usually the medical practitioners, they randomly prescribe, and hence sometimes antibiotic resistance can occur, and in fact is occurring in India rapidly.
Okay.
So we should not just give antibiotics if it is not required. Now for the wound which is having this pus discharge, wound which is having necrotic material, and there is some redness, some edema, those are the patients where we have to give some antibiotics. We can give a broad antibiotic. However, when we are started giving antibiotic, we usually take a culture from the deeper part and what type of organism it is, and depend based on the culture report, we sometimes change the antibiotics.
Okay.
But only when it is infected, when it is not healing, and when the culture is showing, that is the time when to give antibiotics. For the superficial wounds which has not gone into the deeper into subcutaneous or the muscular layer, for them antibiotics is also not required. Only dressings is good enough.
Okay. Sir, when a patient comes to you and he is suffering with diabetic foot ulcer, and what we have noticed, there is some swellings on the foot. On that case, do you think or do you suggest the patient to use compression stocking?
Yes, we do suggest them to use compression stockings, and in our practice we have found that this compression stocking is very good.
Okay.
What happens is when you give this compression stocking, we also ask them to elevate their foot end. In the house, if they are there, we ask them to put pillows, and if they are in the hospital, we usually raise the foot end of the bed. Now this decreases the edema of the foot. Immediately patient will have a lot of relief. First is pain gone.
Okay.
One is pain gone, and the compression is only up to 15 to 25 millimeter of mercury. So what happens is that it's a graduate compression, the edema goes down, and then the arterial compression does not happen. Since the arterial compression is does not happen, and there is no edema fluid there, the blood supply to that particular area is better, and hence the wound healing will be much better.
Okay.
So we regularly do that.
Sir, last discussion you told that laser treatment. So could you put some light on laser treatment and how it helps?
Yeah, laser treatment is now a fashion for everywhere. We are seeing laser, and as technology is becoming more and more, so they have also found that the laser in the diabetic ulcer helps in the angiogenesis. Angiogenesis means it brings more blood vessels. Then to the new blood vessel formation will be more in that area. Okay. Once the new blood vessel formation occurs, nutrition goes, and the endothelial tissue proliferation also, the cells will multiply quickly and the wound will heal better.
Okay.
So we have to do them for various sittings. They have to come for a short period, and then we have to do again a dressing on them. Again, call them after 2 or 3 days. Again, give a laser therapy. Again, do a dressing, and the wound heals very well.
Okay.
So it is little costly, but definitely, if you are able to prevent a foot from amputation, then I think the cost is nothing as compared.
First of all, they have to take care before the ulcer comes.
Yes.
If not, then this has to. I think they should take care of the foot.
Yes.
Sir, what we see right now, also those are suffering with ulcer and any kind of heart issues or something like that. What we have noticed or what I have seen that maximum people are being addicted to smoking. So my question is that how does smoking affects that ulcer,
Yeah.
foot ulcer?
Now, smoking is one of the what you call bad prognostic marker for diabetic foot ulcer. Means the patient is having diabetes, he's more prone to having peripheral artery disease. Now, if he's smoking, then these arteries are also damaged. So, arteries are the one which takes the blood supply to the nutrients to the and all parts of the body. And smoking is one of the factors which leads to narrowing of the arteries in all parts of the body, and hence we do not encourage them. For patients who are diabetes, we tell them not to smoke. We also take them not to consume alcohol also. These are the things. Nowadays, with so much of awareness, people are listening what we
Yes.
say. Sometimes you have to be a little bit more, like you have to explain them. It takes a lot of time. Sometimes it takes 10 minutes, 15 minutes, 20 minutes to explain a person how important is your foot health. Because then once it goes in their mind and brain that my foot is important, and then they take really quit also. Sometimes we have to send them to rehabilitation center or some maybe a psychologist to give alternative, slowly quit smoking, because smoking is something which we cannot quit in one day. It has to be gradual, but definitely if patient is having diabetic foot ulcer, smoking should not be there. It should be
Has to stop.
stopped.
Sir, as you have discussed so many things, and we come to know so many things, and even our viewer will come to know what is diabetic foot ulcer and how to prevent, what is the management, wound management, surgical management. So many things we have discussed. So finally, sir, my final question, last question is that what advice do you give to your patient or to the viewers to about the regular foot care?
Yes. Well, now we all are taking care of ourselves. We are when we go for a party, we we
You
lot
have to test well.
dressed well, we comb our hair. So for my thing to to all the patients who are having diabetes, take care of a foot also. It does not take more than 10 minutes a day. At the end of the night, you clean your foot with nice, I will not say with lukewarm water, normal water is important. Lukewarm water is not to be done because sometimes when they are having pain less, neuropathy is there, they won't know, they may develop some burns. So normal plain water, clean your foot nicely, interweb digits, you must clean properly, there should not be any water lagging, dry it nicely. If you have a little bit of moisturizer, you can moist your foot, inspect your foot properly. You may not do daily but inspection, but at least once a week you should inspect your foot properly everywhere. Everything is normal or not that. In fact, long back we started one program with one company, I don't remember the name. They used to give a mirror to all the patients to to see the foot. The mirror used to be, you have to keep the mirror and see the plantar aspect of the foot, whether there is any ulcer or not developed. If you want to save your foot, take care of your foot, and also at the same time take care of your footwear. So these are the three things I will tell to my patient. And come early to the doctor, but never coming to a doctor is never too late, but earlier the better.
Yes.
Prevention is much better than cure. But suppose, unfortunately, or you have a developed diabetic foot ulcer, don't lose hope. Go to a good doctor. He will take care of your this thing. And with the latest technology, latest orthotist with us, I think we should be able to save limbs. If not save, at least give them a good quality of life. Thank you.
Thank you, sir. Thank you, sir, for joining our podcast.
Thank you. Thank you so much.